White Ventures podcast. My name is Jim Aroune, and we are glad you're joining us to learn more about venture capital in upstate New York, Western New York, any place really. And we spend this time helping you understand more about those who are innovators and founders. We do so in the name of Brown & White Ventures, which is a new venture capital fund that is bringing together alumni of St. Bonaventure University to build a venture capital fund of $10 million to invest in companies in the footprint of the institution in matters such as healthcare and medical startups, as well as manufacturing and tech startups, startups that are founded by women and minorities, and those who wish to begin their journeys in the footprint of the institution. And among those that Brown & White Ventures is invested in as a portfolio company is a company called Well-Connected, and we are here in Williamsville, New York, to meet its founder. Duane Conners is someone who created Well-Connected from seemingly out of nowhere. You have vast experience. We can't wait to share your story with people. But first of all, tell us where we are.
Yeah, thanks for having me.
Yeah.
We're here in Glen Falls Park. It's one of my favorite parks, actually. As my dad's side of the family grew up here in Williamsville, it's one of the parks that I came to as a child, fed ducks, watched the falls, hiked and biked, both here and across the street over in Amherst State Park. And now it's part of just my home and daily life. It's awesome.
It's like a block and a half off Main Street in Williamsville. In case you've never been here before, I'd never been here before, and I was born and raised in Buffalo and Erie County, Orchard Park. Duane, we talk about Well-Connected as a disruptor in a very important sector of the world's economy. And we're talking about healthcare, and we're talking about social services as it relates to those who need them. Tell us what Well-Connected is all about.
So Well-Connected is really designed to transform how people access services, regardless of what kind of services they are. They can be social services, they can be healthcare, they can be housing and food, they can be transportation, they can be education, they can be contacting your government to get that type of assistance. And what we've designed in partnership with hundreds of organizations that deliver that service is a model that allows technology to be that cobweb that sticks everybody together, but allows for a digital no wrong door. Any agency you walk into, anybody you speak with that's on the platform allows you access to all of the services near and far from you that can most effectively help you.
So it's helping the kinds of people who day to day are doing what now?
So day to day, it's helping the people who help people. People who are on the ground working in food pantries, homeless shelters, school systems, whether they're counselors or teachers, county governments, whether they're Department of Human Services or housing and affordability. It's allowing those organizations and the people who support them help their community members access services, but also digitally collaborate with the other agencies who might be helping support any given citizen or human being.
Because what is happening now that you believe needs to be interrupted, that needs to be, frankly, rebuilt from the ground up?
Yeah. So today, nonprofits and social care is the fourth largest industry in America. It also has no real modern technology, no standards, and no real standards that are reportable and accountable. And everything's kind of ad hoc because that's what humans are. We get to do an individual care plan and an individual intervention as we're working with humans. But all of those agencies don't have the digital communication tools, don't have integration with healthcare, or even government services to understand what's available and how things are working to best support their community for success and health and well-being. What we're trying to do is give them that so that when they're helping a person in the real world, they can access not only collaborative case notes and understanding across industries and agencies, but also understand what's available around them to best support their situation and save them time because they're underfunded and over capacity on what they're trying to do. So the goal is build an entire infrastructure that can be utilized using existing infrastructure components to make the lives of those people helping people better.
You have started this, how long ago now?
So the concept for the entire allco platform came about in about 2018.
And allco is the
Is the
name of
product.
the product, right? The service that people touch every day when they're using what well-connected is doing.
Yes. So the concept really came about in about 2018 after multiple years of being a consultant for nonprofits and non-hospital-based care providers, bringing modern technology and modern reporting environments, realizing we were seeing the same thing every day, which was siloed institutions, siloed information, information in notebooks, and how do they aggregate that every month and turn that into a story? But also, how do they access that information from one person to the next to better understand those micro networks and things? So that's when it started building. Rolling out of the last Medicaid redesign, we were afforded a grant from Healthy Community Alliance down in Rwanda to collaborate with 15 agencies to understand, their work mechanics and what they need on their forms, data fields that are required, but also what does community trust look like and how would they collaborate? What would a real digital referral process look like? And so we spent almost 2 years doing that, and then the pandemic hit and we went right into action.
Is there a story that, in your vast experience, which we'll get to in a second, that led you to realize this would be necessary?
Yeah. So I think the key element for me, beside all of the consulting, where I saw the same thing happening every day, where you would lose institutional knowledge the second someone left your organization. You didn't know Jane worked over at the housing while I worked at the food pantry anymore once she left. So now when people came in, no one knew to reach out to them. But I think it all started while I worked at Buffalo General Hospital here in Western New York, coordinating all of our outpatient clinics and some of our nonprofit partners to better understand how we can support our communities in lower socioeconomic settings or dangerous environments, or the needs of transportation, childcare, and all the things that went along with it. And realizing all of that was coming to me in emails and telephone calls and pieces of paper that were being written on and handed to me. And that was the moment I think I realized there was an entire whole community that was helping all the real people every day that didn't have a tool set that made any sense for them. And that was a real use case because, in hospitals, you're trying to do discharge planning, get people into safe environments to, rest up and care for themselves or have others care for them and heal. And it was a really difficult process in a lot of situations. And that's what allowed me to leave healthcare and go into consulting for these agencies. And then once in those agencies, realizing that true collaboration or that true, at least, information and context sharing to better support people didn't exist.
And where Well-Connected is doing business is something we're going to discuss right after we tell you a little bit more here on Brown and White Ventures about Hello Package. A new company establishing secure, accessible on-site space for convenient local package handling for residents and drivers. It continuously onboards and trains residents and delivery drivers, ensuring smooth operations and clear communication. The resident gets delivery alerts with Hello Package, which securely stores packages with controlled access and computer vision, monitoring drivers to address resident shipping needs. Residents retrieve packages with Hello Package, which tracks every interaction to ensure resident satisfaction, using analytics to continually improve service. Hello Package is a portfolio company of Brown and White Ventures. Learn more at hellopackage.com. Back with Duane Conners from Well-Connected. And, you talked about your experience at Buffalo General Hospital. You talk about being in healthcare and seeing social services in desperate need for a service that you've created. Where is it working now?
Yeah. So where have we gone that we've seen a lot of success? So right here at home in Western New York, we have nearly 100 agencies on the platform here, using it, collaborating together, seeing information that historically wouldn't be available. A really strong partner of ours here is 211 of Western New York. So I can't thank that team enough. But because of that, we do have a service directory coverage for New York State and New Jersey and West Virginia, and soon coming Illinois and Cook County and Chicago. Some of the larger, more successful models we've seen have been in a really good example is Monmouth County, New Jersey, where the County Human Services Department led an initiative with up to 60 other organizations to have an intake line and then a support and referral network for all of their community members throughout the county. They have an amazing closed-loop referral rate. For those of you who don't know, that means I've referred someone to you digitally. I actually get the feedback with a status and a case note that says, I've received service, I've reached out to them, this is happening. That's what closed-loop means. They have something around 85 to 90% closed-loop referral rate. That's kind of unheard of. Nationally, in places where we've seen similar types of initiatives take place, it usually only falls between 12 and 20%. So it's an outstanding metric. And more recently, we are in the process of putting a really big project in community information exchange together in Chicago for the Chicago region-wide CIE initiative.
Which sounds enormous. So if I go to Chicago in 2026 and I'm watching people use the system, I'm going to see what when I see people being effective with your system?
Yeah, absolutely. So you'll be able to see shelter workers in homeless shelters intaking a person in a standardized form that connects to their HMIS system. You'll see that get passed off to a caseworker inside of the shelter to get them set up with their bed or their room or their initiatives. You'll also be able to see visiting clinicians who are there for respite care or shelter-based care be able to open a portal, access their social record, understand what sorts of needs exist, whether that's temporary housing, but maybe they lost it because they lost their job or they had food instability or anything. They'll be able to see all of those things and the case notes in the organization that they're in. At the same time, they'll also get a summarization of that person's health record in coordination with some of the health information exchange works that are taking place in the region. Then, if they need more detailed information, they'll be able to click right through and have a viewer into what are collectively ADTs and CCBAs. Those are just care summaries or admission discharge documents from different places throughout the region so that they can better articulate someone's actual test results or vaccine record or allergies, a real clinician's environment in a social care setting. Therefore, taking better care, designing better interventions, and having a much deeper understanding of what a person might need to be successful in that care process.
How do you think your experience prior to launching Well-Connected made you ready for this journey?
I think it allowed me to understand different industries and the processes that take place in all of the weed level parts of it. So I actually started off in investment banking. So I have a really good understanding of the financial systems and how those sorts of things work. Moving from there into healthcare and then getting a better understanding of how care delivery works and how that gets coordinated through to revenue cycle and billing, and then working with the insurance company to help me understand what that audit process looks like, what risk mitigation looks like for members. And then, finally going out into the field with all of these agencies, understanding what their care delivery looks like. But not only that, what are they required to do to tell the story of all of the numbers and statistics and the detail up to the people who fund them? So now, where I am now, I have an understanding of kind of all of those industry process, workflow, and mechanics that make a lot of sense to help an industry that has no real technological or standardized foundation build something from the ground up.
What do you think is broken that helps Well-Connected arrive and say we can?
The biggest piece is communication and context. Right now, the amount of organizations or folks that I work with on a daily basis to onboard them that are getting away from having Post-it notes on their monitor or a notebook that they just have to fire through, all three of them, to figure out what were the notes from this person the last time they were here and who did we connect them with. But then their ability to share that with another organization, especially if I'm a housing organization and you said someone with food or transportation or childcare, Right now, that's me knowing someone who works there and texts them or emails them or hands them a piece of paper at that time. That sort of disconnection actually gets solved inside of our platform. And not only for social care, but for every industry partner and industry that wants to collaborate with social care.
It must be frustrating for people who work in this part of our community net to know that as hard as they work to solve problems on sometimes a minute by minute basis, the lack of standardization and expectation for that standardization can really foil their efforts, whether they're an agency that's large or whether they're a new shelter that's just trying to help.
Absolutely. That lack of standardization, which we actually tuck behind the scenes. So it just feels like you're filling out a generic form or the form that you custom built. But we put all of those things in place behind the scenes, and we can drive those so that there's apples to apples reporting, so that now you can understand inputs and outcomes and data collection and statistics and counts regionally instead of just agency by agency. Because the downfall of that we've seen today is that when you've seen one grant to support your services, you've seen one grant to support your services. The reporting metrics, the communication, all of those things change grant to grant. And our goal is to get into an environment where we can allow them to just do their daily jobs, and it automatically creates an environment of reporting and analytics and substantial outcomes that is just standardized for all those agencies. So they no longer have to lose 2 to 3 days a month aggregating and coordinating information across different systems or pieces of paper in order to write a document to respond to a grant.
And so you arrive in this change mode, knowing the most consistent challenge you'll face as you introduce your service in communities and municipalities and broader government infrastructures. Besides the fact that there is this silo nature to the work that you're trying to address, is what?
So the biggest challenge that we face now, the first one is adoption, right? So change management. If I'm taking care of people throughout a day, I get really used to the way I do it. I have a binder of papers, I fill them out, At the end of the day, I go in and then I dual enter all that information. Or I don't. It's just their binder or my notebook, and that's how it sits. That, going from 0 to 1, is the biggest challenge because we're doing it at such a wide swath. And we're doing everything in our capabilities to do that for everyone in a way that fits their workflow and how they're used to it. That's why we've built a number of tools that allow people to customize their user interfaces. We can mimic forms, we can mimic how they case note, how they do everything, and get them accustomed to that digital interface. Healthcare went through the same process at the end of the 90s and into the early 2000s. The difference being the federal government funded it to the tune of $200 billion. They're not doing that for the fourth largest industry in America. Our goal is to do that in a way that makes them feel like it was designed for them to do that. And we're having our challenges and we're having our wins, and we're learning along the way, along with all of these community-based organizations, on how to best do that. The next side of that is value. So understanding where the fiscal value for what I'm doing lies. Does it lie within my organization and how I report to my grant funders? Does what I'm doing actually provide a fiscal value to other industries or other agencies, whether that's the government or whether that's healthcare or whether that's other technology or financial institutions? And then how do you move so that value becomes a shared entity now that everybody can have access to the information that I'm providing?
We're going to learn more about Well Connected from Duane Conners here on the Brown and White Ventures podcast after we learn a little bit more about CAV Helmets, a dynamic disruptor in manufacturing, leveraging AI and 3D printing to produce custom-fit, top-of-the-line cycling helmets as safe as any on the market. CAV allows cyclists to take a single selfie of their head, and with that image develop 108 measurements to produce a one-of-one helmet for the serious cyclists. CAV's new Roan helmet is taking the cycling world by storm. 3D printers produce nearly all of the helmet, Cav manufactures these helmets in a micro factory in Buffalo, New York, part of the commitment it made when it became a Cohort 9 winner in the 43 North startup competition. Cav has now moved all manufacturing to Buffalo as it prepares for its next step. Cav is a portfolio company of Brown and White Ventures. Learn more about it at cavhelmets.com. Back at Glen Falls Park in Williamsville for this edition of Brown and White Ventures podcast with Duane Conners of Wellconnected, a fantastic new startup, new portfolio company of Brown and White Ventures that addresses social services and works to make them more effective through communication and technology. There's not a lot of AI in what people actually handle. That's actually kind of back office stuff for you guys.
Yeah. So we have become pretty positive and efficient users of AI tools such as Claude to help us make the tool set better and document and help us innovate even. Sometimes it thinks of things that we haven't thought of, and most of the time we correct that, but sometimes it allows us to kind of expand our horizons, to think outside of the box. We are releasing in the fall a toolkit that will be our first user interface for an artificial intelligent agent. It's only a summarization tool set for health records to allow a layperson or non-clinical person, such as a caseworker, to have a summarized health record in just 3 bullet points, health and behavioral and pharmaceutical, to better understand someone's situation and context as they're coming in. And if that's in real time with connection with health information exchanges or EMRs, depending on which part of the country we're working in. And we are finding that that's a tool set that is hugely advantageous, especially for agencies that are working cases that involve chronic illness, or even just areas of the country that have food shortages. I think we have better understanding whether people have refrigerators, what they're allergic to, or if they have hypertension, or they might be on a statin, or things like that. Just really basic context with a set of information after to allow you to drive a motivational interview, if you will, to better understand their situation and help.
There are companies that would claim to be competitive with Wellconnected at this point, but really, in your measurement, there aren't, because you do things differently from what may be siloed services. You want to explain that?
Yeah. So we have a number of organizations that historically may have been our direct competition. Nowadays, we work a lot more as interoperability partners or integrations with, and those are really for the services that 211s provide or disaster response organizations provide. And our goal is not, these are softwares that have been designed specifically for those use cases, and our goal is not to interrupt those of them. We want everybody to seamlessly collaborate and work together as best everyone can. Then there are other organizations, like Unite Us and Find Help, who have a really distinct focus on healthcare and bringing in social information into what they already provide to the healthcare industry, whether it's hospital systems or insurers or networks. Our goal is to not necessarily compete with them, even though we kind of get put in those buckets. Our goal would always be we built a system with community-based organizations for community-based organizations, like hand in hand. And our goal would be to be a better front end, get them better records, get them more information, and once again, be an interoperability partner, just like we do with health information exchanges and EMRs and 211 systems or disaster response services. We just want to have that information to be available for the right person at the right time, no matter what system they're using, regardless of where they are.
How does Wellconnected manage frankly the volatility of a commitment from one government administration as compared to the next or the prior, or the idea that you can be staying power in a community even as it evolves its leadership?
It's such a pertinent question. So we're living through one of those big transitions right now at the federal level. And seeing our participating agencies, have the hesitations that they're having, wondering where funding might come from, those types of things, where that wasn't a concern for the previous 4 years, especially coming out of the shutdown, where funding for these types of initiatives was pretty prevalent. And I think what we're doing for the entire industry as a whole is not only are we allowing digital collaboration and allowing better intervention design and helping people do more with what they have, we are creating massive amounts of efficiency on how I can report on it, how I can understand where my funds are going, where that transparency is, giving any agency that individual ability to immediately tell their story and say why we need the funding we have, if it ever came down to it. And so what we found, regardless of what side of that political spectrum any community might be on, we are still an additive feature. We still become a part of the fabric of that community and how we can connect people to their resources. That part of human-to-human interaction is what makes our technology fundamental for all of these communities and gives us that kind of stickiness or staying power in any community that we're in today.
You told us about the AI aspect that you're going to be introducing shortly. The next big step for Well Connected becomes what?
So I think the next big step for Well Connected as a whole, given our amazing partnership and investment from Brown and White, is really to not only just scale into the footprints we already have and bringing on new employees, but also new resources, some better information and outreach, but also to participate in additional RFPs or new markets, where now that we've gotten to this point, we have new funding behind us, we have more ability to be responsive to the needs, but also the support of the community, building out additional features that allow adoption to increase, that allow market prevalence and that flywheel of network effect to take place. That's really where we're going. And there's a number of tools that we already have on the docket that we want to build, and a number of types of resources that we want to add to our team to bring those people on. And I'm talking about places like we are in opportunities in the U.S. Virgin Islands. We're hopefully in opportunities in Indianapolis and other places like that. The state of Washington has a number of opportunities going on. These are all things that we have been looking at, and now we will be actively approaching to make more communities more collaborative.
People certainly hear the passion in your voice. Why does this work for you?
Because it's awesome. I get to build things that help real people every day. And, I have a really higher level of self-awareness nowadays, especially after being a father, that, we're only human. You can only leave whatever mark you can. And my goal is to just leave this place better than how I found it. And I think I have a really good opportunity to do that. And everybody in our team and every community that we support also has a really good opportunity.
Well Connected's going to get its chance thanks to Duane Conners, who's spent a great little bit of time here helping us understand why it's going to do so. Duane, best of luck to you. Congratulations.
Thanks, Jim.
We're glad you're joining us here from Glen Falls Park in Williamsville. Not a bad spot to spend some time learning about social services and how they can get better. And we are glad you joined us on this edition of Brown and White Ventures. We'll see you next time.